The reason to become an entrepreneur is kind of to make sure we can really deliver on that. We have all this amazing work we're doing in terms of research and the science, but to see the impact, you have to create a business. I spent many years in research and saw some amazing work that never really went anywhere after the research projects finished. So I was involved in, for example, lots of European funded, publicly funded research projects. Really, really amazing work, but quite often that work would just kind of sit in the lab afterwards, wouldn't be exploited, nobody would do anything with it. And deciding to kind of to commercialize the results of some of that work ourselves, kind of my early career. And as we were spinning out of Telefónica Alpha, we decided to focus on mental health because we realised that mental health is kind of at the core of every chronic disease. If you can't address the mental health issues, it's really difficult to kind of enact any behavioural change towards the end goal in the chronic disease. So for us, because of the goal of the company and the importance of the impact, I think this has helped us attract a lot of people who really believe in the mission. A lot of our team come into this sometimes with personal reasons, but at the very minimum with kind of a general sense that they want their work to have real impact in the world. So working on something like mental health gives them that. Realising that healthcare should be seen as a service rather than a product has been one of the key strategic decisions we've made. I think for me it's always remembering to focus on the outcome, so that when we talk about our mission being solving the access problem for mental health, everything we do and everything I do should be working towards solving that access problem. And it's very easy to get distracted, to start thinking about other things, to kind of go down rabbit holes. But if ultimately the thing you're doing isn't one step closer to that goal, you shouldn't be doing it. So just keeping that high level mission in mind all the time is the most important advice I've been given, I think. I think there are two things. You have to really understand the problem you're starting with. And built into that is the assumption is you're starting with a problem rather than a solution. A lot of health tech, med tech companies start with a solution, they develop some technology, but you really have to start with a problem, understand that, and then think about what technologies might help you solve the solution. It would have been useful to know how the market was going to change so much, in the time that we've been around. We might have thought about things a little bit differently in terms of our timeline, but nobody can see the future, so I don't feel too badly about that. So in the next couple of years, we've developed a portfolio of solutions. So we have an app for well-being and prevention. We have some clinical programs. We've been running some randomized controlled trials. Over the next kind of 6 months to a year, we're bringing all of these pieces together in a comprehensive mental health care service. So getting that out into the market is really the next big milestone, where we start to see the impact of each one of these individual things that we've been working on in the last couple of years.